Good morning, everybody. It seems pretty clear to me that Tenant or Tech or both do not want me live streaming from work. So we'll just record and post. It's fine. It doesn't really matter to me. And then if you've got questions, you can PM me or comment or whatever you want to do. It's even hooked into my cell phone, so I can see your comment pretty much anytime. Okay, taking medication during pregnancy and breastfeeding. So first things first, my standard disclaimer, your doctor knows you better than I do. Please talk to your doctor about specific stuff. But I do want to give you a way of thinking about how you're taking medication and kind of my take on this, because nothing causes moms more stress than trying to figure out how to balance their health with the health of their baby, whether that be a baby still inside them or a baby they're breastfeeding or whatever. And I don't want moms to stress about this. I also hear a lot of people who have opinions about what we do and do not put into our bodies and kind of give you some sense of where they're coming from. Okay, so a couple of years ago, the Food and Drug Administration, the FDA, changed the way they talk about medications in pregnancy. It used to be they had these really cute little letter classes. There was A, B, C, D, and X. X was really bad, if you can't tell. And it was very simple and very consumer friendly. If it was an A, it meant that it was totally safe. If it was a D or an X, it means we don't really suggest that you take this. X's were like, don't ever take this when you're pregnant. And then B, C, and D were sort of these shades of gray. Do we have good human data? Do we have good animal data? What do we recommend? It was really consumer friendly. What it wasn't was doctor friendly, because it didn't tell me how those decisions were made. It just kind of gave me this arbitrary rating, and then I had to figure out what the story was. What they did in 2015 was, they're phasing this in now. Drug companies will now have to publish like a summary of the research on toxicity in pregnancy and breastfeeding as part of their drug information. And it's not just a letter, which is what it used to be. It's actually a description of the studies that have been done, and then a little summary at the bottom of the recommendations for pregnancy, in like plain English, related specifically to the drug we're talking about. This is so helpful for me, but for someone who isn't medical and is just trying to figure out if they should be taking Tylenol when they're pregnant, it's maybe not the most user-friendly system. So if you're gonna, first of all, if you're gonna go look this stuff up online, I use drugs.com and rxlist.com, but you do you. I recommend that you scroll all the way down to the bottom of that information, and that last paragraph is kind of the point of the whole thing. The other thing that readout contains is information on any drug registry related to this medication. So if there's a concern about a drug in pregnancy, but it's something sometimes people have to take, they will take, they'll kind of take information from doctors on who's taking it, track those patients over time, and then really try to build up that data on exactly what the risk is in pregnancy. So if you're interested in being part of a drug registry because you have to take a medication while you're pregnant and you do have concerns, ask if there's a drug registry, or go online and find out, because that's an avenue that's always open to you. Here's the other problem with this system, is if you get down to the bottom paragraph I was talking about, here's what it's going to say. There are some risks associated with this medication in pregnancy and breastfeeding. Please consult with your doctor to decide if the risk of the drug is outweighed by the benefit, which isn't especially helpful because that's pretty much what they all say. And then if you try to read the main text, it's going to say something like, in a study of 4,000 rats, they found that the pregnancy toxicity was seen at 0.85 of the LD50. And you're like, I don't even know what any of that means. It's horrifying reading, even for me. And if you don't have to, you might want to avoid it. But in all seriousness, it's just not, it's not user-friendly. And so it really pushes the conversation back to you and the doctor as to where that safety line lies and where the risk benefit lies. But here's sort of how I think about it. There's 3 kinds of drugs we take in the United States generally. One of them is comfort medication. Okay, so this is stuff for a minor headache. This is heartburn medicine. This is allergy medicine to some degree, acne medicine. Like, if you don't take it, you're not going to die. Okay, cold medicine definitely falls into this category. Then there's the other extreme class, which is the drugs that your body is dependent on so much that if you stop them, you are at serious risk of harm within the next couple days to couple weeks. I'm talking about things like insulin, seizure medications. If you have severe high blood pressure, it can be this or your diabetes medication, depending on how well controlled you are. Those are things you can't just stop. You have to kind of address how you're going to cover that need, or you're really going to get sick, and then the baby's going to get sick with you. Neither of those, though, is really where the problem lies. The problem is the medications that fall in the middle, in that third group. And those are our long-term disease management medications. So things that we take because either the condition we have, if we don't take the medication, the condition does not allow us to function on a daily basis. You're not going to die, but you might not be able to go to work. You might not be able to take care of your kids. So I think migraine medications are a really good example. And then the ones that manage long-term disease. So if you stop it today, you're probably not going to hurt yourself. But over months, you may create enough damage that your health could be at risk. These are the blood pressure medications, the type 2 diabetes medications. Behavioral health medications would fall into that general, under that umbrella. So in general, you're going to weigh risk and benefit. Okay. We would prefer, as your child's doctor, if comfort medications, unless they are perfectly safe, unless there's no risk to your child, we do want to minimize your exposure there, because you maybe don't need them as much. If it is a truly life-sustaining medication, insulin, seizure medications, etc., you have a couple of options. One, you can talk to your doctor about changing the medication. So I'm going to go off of this seizure medicine and onto this one, because the one I'm taking now is super toxic to babies, and maybe we can find something that's at least a little bit better, but will still keep you safe. If you take one of those life-saving medicines, I highly recommend that if you are a woman between the ages of 16 and 45 or so, that you talk to your doctor about what would happen if you happen to get pregnant. Don't wait until you find out you're pregnant to have this conversation. Talk about it now so that you know as soon as you find out that you're pregnant, because surprises happen, let's all admit it. Lots of people have surprise babies. That you have a plan in place, that you know exactly what you're going to do. And if you're trying to get pregnant, I would make that change now, not once you find out you're pregnant. Because those first 2 weeks, when you don't quite know you're pregnant yet, are absolutely critical to development. And we can't be messing stuff up in that time range. So that's comfort. The life-saving ones are pretty clear. Now it's everything that falls in the middle, which I would say is 90% of what we take in the United States. It's stuff that's going to manage your disease long-term. So the FDA's publication and the drug company's information is going to present you with all of the risks of the drug to your baby. Okay. What it's not going to do is it's not going to talk about the risks of the untreated disease in you to that baby. Okay, so blood pressure medications, some of them have risks to children when you're pregnant or breastfeeding, but the insert in the drug package is not going to tell you about what happens to your placenta if you have high blood pressure sustained throughout your pregnancy. And here's a tip: it doesn't grow well and your baby doesn't get great blood supply, and that's their lifeline. So sometimes we focus very much on the toxicity of the drug. We don't focus on the negative effects of the disease. So if you are in this position where you're taking long-term medications and you are pregnant, the conversation to have with your doctor is this: if I don't take medication for this condition, if I take nothing, what could happen to my baby? If I take a drug different than what I'm taking now, something lower risk, is that possible? And if I continue to take my medication as prescribed right now throughout my entire pregnancy, what are the potential downfalls of that? And then between you need to make a decision about what you're going to do and what risk you're going to assume. And I'm going to say that again, what risk you will assume, because anytime you go off a medication and you allow disease to progress in your body, it does put your baby at risk. There is no good answer here. There's no, absolutely every time you should not take, I don't know, whatever medication. It's all about you and your body. And it's about the risk that you're going to assume. The risk you're willing to take, you're going to have to pick one. And for first-time moms, this is particularly anguishing. I think by the time you have a kid, you kind of come to this conclusion that every decision you make has risk. Every decision you make has benefit. And you got to figure out what's right for you. What's going to let you sleep through the night. So let me talk for a second, though, about one particular class of medications that I think the judges come out in some folks. So let's just say it outright. If you have a chronic pain condition or you have a behavioral health condition that you take medication for and you want to get pregnant, the conventional wisdom is you need to stop those medications because they're a risk to the baby. So at some point I can tell you my story about the awful nurse practitioner I saw right before I got pregnant with Eli. She freaked me out about medication, and I'm a pediatrician. I can't imagine what she's like with other people. It was awful. But the upshot of that visit was, if you don't stop your medication, you're a bad mom, because it could hurt your baby. But what never happened was she never asked me why I take medication, what the disorder is, what my medical condition is, and she never once asked me about the risk to my child if I don't treat what I have. Okay. And I think a lot of people in this world do that. If you are under constant stress when you are pregnant, there is a risk to your child in terms of development. Those stress hormones that you produce do impact your child's development. And the thing is, we don't even really understand how far that rabbit hole goes. We know it affects them. We know it can affect them for the rest of their life, but like to define exactly what could happen, that's emerging research. And so if you are under constant pain, or if your depression is untreated, or anything like that, you are secreting toxic chemicals to your baby. If you take medications, you are taking a medication that has a certain toxicity. You are in a really crappy position. And you have to make that decision about what risk you are willing to tolerate. Can you turn down your dosage? Can you change your medication? Is there something you can do? But what I don't want to do is paint this as an easy decision for you, because it's not. And it's just as hard as every other parenting decision you're ever going to make. So whatever you choose, I support you 100%. I know that moms almost always make the best decision they can for their kids. I trust that you will make the best decision that you can for your kids. Oh, and so here's the thing. If you're watching this video and you are not a mom or a dad of an infant or about to be a new mom or dad, and you have concerns about someone taking a medication when they're pregnant, if you know that person well enough to know their middle name, and if they have told you the new name of their incoming child, okay, if they've already shared that information with you, and you also know the person's middle name, you are close enough to express concern. And this is what that sounds like. Hey, have you talked to your doctor about taking that medication? Is that safe? Oh, okay. And then drop it. If you don't know this person's middle name, if, God help you, if you've never met them before because you're on Facebook, if they don't feel comfortable enough with you to share the baby names they're thinking about, and I know people who do this, you're speaking from the heart, you're speaking with care, you're speaking with knowledge and education, and I love that. Zip it. Seriously, zip it. Just don't. Please don't. because you have no idea the anguish that that mom is going through trying to make the right decision for her kid when there's no good decision. And I put this in the class of, at best, unsolicited parenting advice, which I hate. And like, as a mom, it makes me nuts. At worst, you're mom shaming. And it's not okay. So if you are a professional that's been consulted, or you're a close person to the expecting mom or the new mom, express concern once and then leave it alone. If you're not, shut it. Because it's really none of your business, and you don't know what that person's going through in their life that helps them make that decision or drives them to make their decisions. If you've got specific questions about how to talk to your doctor about this, or if you're not thrilled with the answer you're getting, you're welcome to message me and I can kind of guide you through it. If you want to talk about specific medications, and you already have a baby and you're breastfeeding, I can surely see you. Otherwise, you need to talk to your own doctor about that, because I can't necessarily give you straight up medical advice not knowing your whole situation. I hope everybody has a great weekend. I hope everybody joins us. If you're not aware, if you're a member of Moms on Board, they are having an event up here on August 11th. I will be doing physical exams, so if you want to stop in and say hi, feel free in our adorable little clinic. Otherwise, enjoy your weekend. Please let me know if you have any questions.